Joining us in our newsroom, we have Dr. Paul Helft from IU Health. Hello, Dr. Helft. How are you? Thanks for joining us.
Thank you for having me here.
So we're talking about a certain change in guidelines for a certain cancer in terms of screening. So first question is, what cancer are we talking about?
So we're talking about screening for colorectal cancer, which is one of the leading causes of cancer and leading causes of cancer mortality in this country. 150,000 Americans who get colorectal cancer each year.
And what do you think prompted this change in the guidelines? So we went from being screened at age 50 to now it's 45.
Right, so over the past approximately 30 years, Mary, there's been accumulating evidence that younger and younger people are getting colorectal cancer. So even though this used to be a disease primarily with an average age of in the late 60s to early 70s, the age of acquisition of the disease has been going down for the past 30 years. We're seeing about a 50% rise in patients who are younger. And now up to a third of patients are under the age of 50.
Why do you think that is?
Well, there's several theories about why that is, although no researcher is absolutely certain of the reasons why. Some of it has to do probably with larger trends in the population, like weight gain and obesity. Some of it has to do probably with diet and changes in dietary habits over the last few years, but nobody is really sure yet.
Okay. So lowering the guidelines hopefully will catch this cancer earlier and will save lives. But the change is not from the American Cancer Society. The American Cancer Society already had these guidelines. They were the guidelines, these have been the guidelines. It's the U.S. Preventive Task Force Services. So explain the difference between the two, and why is now the task force just catching up to the American Cancer Society?
Yeah, it's a little unclear to me why the U.S. Preventative Task Force decided to release this recommendation at this time. The American Cancer Society, of course, makes recommendations regarding things like screening tests for cancer. And several years ago, in 2018 specifically, they came out with a lowering of the average age for screening recommendations from 50 to 45 because of this trend in the acquisition of earlier and earlier ages. So I'm not sure why the U.S. Preventative Task Force has, just right at this time come out with this new recommendation. I agree with the recommendation, by the way. More and more, I have seen patients in their 20s, 30s, and 40s, and it's likely that if we lower the average age of screening, we'll also earlier. The earlier you find colorectal cancer, the more curable it is.
And your opinion, the differences between detection, we can have samples, we can have a colonoscopy, and then how do we get people to comply with these recommendations?
Yeah, so this has been a big problem from a public health perspective because to this day, around 60% of people over 50 are screened regularly for colorectal cancer per the guidelines. So there's still almost half of the population, even over the age of 50, that's getting screened. And there are many complex reasons why that would be, but many people make a choice or they're not offered choice for screening. And now, of course, we're recommending that we do that at a younger age, at the age of 45. But at the very least, people at the age of 45 ought to have stool samples tested with blood, which is a common way that it's detected. There are other stool tests, like DNA tests that can be done that are non-invasive. And then colonoscopy is certainly the gold standard for testing.
Well, Dr. Helft, thank you so much for your insight on this topic, and we look forward to having you on again soon.